Hello, this is Tony Kelly. Welcome to Birmingham's Breakthrough TV, Our Health is Our Wealth show. Glad to have you watching this again. Now, my next guest is somebody who I know very well. Her name is Paulette Lewis, and she has an MBE, which we'll talk about later in the show. But Paulette Lewis and I'll let you into a little secret, viewers. We went to school together, and we were in class or form, depending on where you're from, together. So nice to have you, Paulette. It's a pleasure to be sitting here viewing, having the listeners hear you. But you're all the way down in Croydon in London. We need to establish that. How are you?
Oh, good evening, Tony. It's a pleasure to be here this evening, and thank you for inviting me onto your Breakthrough TV. Wonderful to be here.
You're welcome. I'm pleased to have you. Now, let's start by saying, telling the viewers a bit about your childhood, your early upbringing. That's where we'll start.
Right. I was born in Portland, Jamaica, and I came to the UK at the age of 3. And while I was here, my parents decided, for many reasons, to take us all back. I'm from a family of 7 children, and I'm in the middle. So we went back to Jamaica, where we were educated, because that was the main reason why my mother wanted to take us back. While we were here, she didn't think we were getting the type of education, and we decided to go back to Jamaica. And also, for family reasons, my father needed to go back to take care of our properties and things like that. But it was a pleasure growing up in Jamaica when I got there, the sea and the sun, just running outside, picking the mangoes, roasting breadfruit and catching janga at school time. That was really great. We had lots of mango trees, more mango than you could imagine. So I think that was really good, being outside and enjoying life out in the West Indies. So that's where I grew up, and that's, and actually being in school and in Jamaica was a plus. Went to Happy Grove Grammar School, which was walking distance. And as Tony will tell you, I was supposed to be a great athlete. I used to run, and of course I used to get cheered and booed because I wasn't very good at it, but I was always a trier and always taking Bancroft House I was team leader for at one point. So I love sports. Drama, we did a lot of drama at the high school as well. Mr. Lopez, dancing drama, was fantastic, and was really great. And it was great, growing up with a family of all these children, where you had lots of fun and playing baseball, basketball, and all those sort of things out there. It was really great. I enjoyed it.
Yes, and that's, as I said, where we met each other and have maintained our friendship ever since. Then you finished high school. What did you decide to do after that?
Well, actually, while I was in high school, I wanted to be a teacher at one point, and then I wanted to be a nurse. But nursing was more what I wanted to be. I'm someone who's caring, want to look after people all the time and be the mother figure, caring and things like that. So I remember distinctly, Mr. Sartrell, you may remember Tony, our headmaster. This lady came from England to speak to us, and one of the things she spoke to us about nursing in England. And I was very fascinated with that, asked lots of questions, and then that's what really gave me that impetus to follow through, and I started to investigate how could I get to England to undertake nursing. Wow. But before that, when we finished high school, I wanted to be a teacher. I wasn't quite sure, so I did apply to Michael College, which I was accepted. So I had the Michael College and I had the nursing. So I did opt to be a nurse, but I did do a little teaching at the Mitty Old Primary School, which is not far on the border of Portland and St. Thomas, for a short while before I left for England to undertake my nursing career.
Oh, I see. So that's news to me, because had you gone to Micah, that's where I studied, at Micah Teachers College. Our paths would have crossed there again, but but it did. You came to England. So the year you came to England to do nursing, was when exactly?
1975, I think, around that time.
Right. And where did you do your nurse training?
Well, when I came, actually, I went to Sunderland, would you believe, of all places. Sunderland, which is up to the border of Scotland. And was it cold? And of course, being all the way up north, I didn't see very many people like myself. So I had a number of challenges, as you can expect, managing the cold and managing the culture, and then managing a new career, a new place to live. And everywhere seemed like, it was like a church, it was cold, it was smoky. And I must admit, I did meet some wonderful people. They were very friendly, and they had to look after me as being one of the very few. So some of my experience up there was really positive as well. In some of the people up in the north, they were really very wanted to look after me. And then I left up north and then came down to London.
You came south, okay.
Mm-hmm.
So you mentioned you were drawn to the nursing profession, and you said earlier it's to do with your sort of caring attitude, caring, wanting to look after people. I have to say that could have happened in teaching as well, you know.
Yes, I guess it would have in a different way, but there was something about nursing, being with people, a variety of different people, and having read the books and watched the movies. I was drawn very much to that sort of bedside caring as well. And as you know, when you get in a profession there, at the time I didn't know what opportunities were there, but it's something as a child, you play doctor and nurse is looking after people. And I was always a nurse. So that was really my first choice.
Choice, right, okay. So here you are, you've qualified as a nurse, and then you mentioned that you headed down south to the bright lights of London. Tell us how your nursing career developed from there.
Actually, yes, I went down south sooner than I'd expected, because as you may have heard in many of the articles, a number of nurses who came from Jamaica to do nursing here. We did our O levels and all of that back home and A levels. When I got here, I was put into this SEN group, which was not a registered nurse. And so one day my tutor said to me, this Englishman, he says, "Lewis, your papers and all your biology, gosh, And then I started to talk to him, and he says, "I think you're in the wrong class, the wrong group." And I said, so then I questioned him and said, "Well, 2 years, I'll finish nursing and get back quickly." He says, no, that's not how it goes. This is not the right. And then he was very kind enough to sort of sort a hospital in London, just outside of London, and transferred me down into London to undertake my state registered nursing, because I was actually allocated to the wrong course when I first came. And so I went to King Edward's, the 7th Hospital, just outside of Windsor, overlooking Windsor Castle. That was part of the group of nursing. I went in, completed my state registered nurse, and then I went on and did my midwifery. I did some psychiatry. I did burns and plastic surgery, and some of those other things. And then when I did my midwifery, I did really love being a midwife. And I stayed and worked as a midwife. And then I was promoted to a ward sister within a year, which was unbelievable, people thought. But it was something I really loved. And then I became a team leader. And then I went off to America to see what America had to offer. And when I got to America and was working there for a while, I realized it was really very different. They were very theoretical in their work, but practically the English girls that were there were really keen. And I really enjoyed working there. I learned a lot, but it was really very different. So I went back to university there, because when you go to America, you go to really do the state board exam again. Went to Pace University, did a degree in nursing as well. But I didn't stay, because I was very much a midwife looking after women. It was very medical intervention. So I had to do a lot of work. I worked a lot with the doctors, trying for them to understand how we can get normality into maternity care. Before I left, they started calling me Dr. Lewis, because I would be intervening and trying to get women to deliver normally. And not. They had 60-something% cesarean section. When I left, that had reduced probably by about 20%, because myself and another girl by the name of Brown from London was sort of working with them to show them how we can let women deliver normally and not so much intervention. So that was really good.
And what part of
And
the
then
States was this, by the way?
that was Bronxville, Westchester, going out in that area.
Area, okay.
But it was a nice area, nice place, nice hospital. I learned a lot about quality assurance. They were very meticulous about record keeping. You know, there was a lot of things I learned there that I was able to bring back with me here and to use some of those experiences in my clinical practice.
Right.
So when I got back here in the UK, I started to look for a job. And it was very difficult because every job I went to, they used to tell me, "Oh, I don't think you know, you're going to stay. You're so experienced, you know." But I know it wasn't only about me being experienced. And it took me a while. And then I said, okay. And then one day, this lady said to me, "Oh, you need a much more senior post." And I couldn't understand what. So I thought, well, a challenge. So I did. And then I applied for a post 2 grades higher than what I wanted, and I did get it. And that was a springboard of me moving into management. So that was really good. I became a head of midwifery, then a director of maternity services, women's services, children's services, general manager, executive director of nursing for a period of time. Then when I left that, I became the director of the Pan-London Maternity Services to review maternity services across London to see how we could improve maternity services. And that was completed. Then I went into commissioning, which was different. How do we commission services for women and children? And I think that was important, having someone with a clinical experience as a commissioner, because we understand the services which were required and were able to influence services. And I think for me too, as a Black woman, my Black minority person, it's sitting around the table where we're commissioning services and able to look at the needs analysis around why we're not commissioning this type of service. This is what we need. So influencing policies and influencing the type of service that I think the community need was really important. I learned a lot around commissioning. And then after that, I went on to be director of community services in 2 different areas and did a lot of amalgamation and things like, you know.
All right. Wow, quite. And I like the meteoric rise. This is going up the ranks quite quickly. So how do you put that alongside when you hear about the National Health Service? I see a lot of programs focusing on the National Health Service, and they tend to airbrush people like yourself who have climbed the ladder and are in very senior management positions. The media doesn't tend to focus on them. It's always seems to be a sea of white people that the media, if you look at newspapers and so on, they're the ones who always get the attention. Why do you think that is?
Well, again, you know, we talk about the unconscious bias and people understanding. I don't think a lot of people understand the importance of the diversity of the Black and minority people that brings to, and the richness it brings to not just the health services, but all services. And it's easy to forget that we exist. And I think because of that, and there was an outcry when all these pictures were being put out with all these white nurses, when most of the frontline nurses, which were more Black and minority ethnic nurses, were dying. And that woke up a number of people saying, should we be waiting on these people to promote us? One of the things we need to do is collaborate together and start shouting our achievements and promoting ourselves. Because after that happened, I had calls of people saying, have you got pictures of Black nurses? And I ran around getting pictures of Black nurses so that they could use them on televisions or in different articles. Now, that should never have happened. But sometimes what that taught me is that sometimes we have to take, go out there and say, we need to promote ourselves and who we are. And, but I think there is still a lot of unconscious bias. I think people understanding the wealth of diversity is still there. We have come some way in terms of accepting that we are as good or better, but I think we still have quite a long way to go. And by educating and working with those groups of people who don't understand, haven't walked in our shoes, And I think one of the way of doing is let us stop talking to ourselves. We need to be talking to those people who, for some reason, don't understand our experiences and don't understand what we're talking about. So sometimes we talk a lot to ourselves about the issues. We need to collaborate and bring those people around the table to educate them.
I like your use of the word collaborate, and I've seen you speak on a number of occasions, and you like to use we mustn't work in silos. Explain that to the
Exactly.
viewers and listeners, please. What silos are and why you use that term.
I think for me, no man is an island, and we need to change attitudes and behaviors. And one of the reasons why even now I'm a non-executive director, if we're not sitting at the table to make differences, how are we going to change people? So we have to talk about our experience, our lived experience, and let people understand. We have to sit there and call out what is not right. And sometimes somebody has to put their head above the parapet in terms of saying, this is not right. And some of us are more confident in doing that. So by helping, so I help, I mentor, I coach, I support the other nursing staff, anyone. Because more people like you or I, whatever, the more of us who are willing to call out and to sit around the table, we can influence more. And if we stay in silos, we won't learn from each other. And sometimes when I speak to some of my white colleagues, and I've done that and I've challenged them and explained, I see the behaviors have changed because I'm starting to say, no, this is what you need to understand. You might not understand. And I've seen where some people are really starting to understand. This is our time. With COVID, with the pandemic, it's highlighted all the inequalities of health. It's highlighted so many different issues. And we cannot let this time escape. We need to use it and collaborate and bring those people around the table. I know sometimes people feel we cannot talk to ourselves. And I know Black History Month is great, but we should have Black History Month every
Every
month.
month. I agree with that. I applaud you on
We
that
need to
point.
be talking that topic every month. We have something about why have we got all the Black films showing this month? Some people can't even watch all of them. We should have it right along because we need to make that be something that is ingrained in our everyday life, every day, every month, every week, if we're to get the changes we want. And I think that's really important.
I'd agree, Paulette, because when we say teaching Black history, the white people can also get an understanding and a take from that. Because remember, the National Health Service was formed 72 years ago. And then, of course, a lot of people came in 1948 on the Windrush ship. So it's so important, as you rightly said, to encourage and make people you go out there, do a lot of mentoring, and I'm sure there might be students and young people watching this wanting to come into nursing. What advice would you give to them as somebody who has climbed up the ladder as a senior manager? There's so many senior posts you've held. I'll just read out a few of them. You've been in the National Health Service, a director of midwifery, children's services, and executive director of nursing in a large acute trust and community services. You were the former president of the Nurses Association of Jamaica, UK, and chair of Croydon's Black and Minority Ethnic Forum. So you've gotten your hands dirty in more ways than one. You're not just climbed the ladder and remained up there, which is you've given back to the community. How would you encourage other people wanting to come into nursing, watching this program, people going through high school, colleges, etc.? What advice would you give to them?
I would say, for me and the experience, I think nursing and community health service has so much to offer. I mean, health service offers being a nurse, a midwife, a psychiatric nurse. You can come in through different programs and go into management. But nursing, for me, is one of those things I'm really proud of being a nurse, able to give and to use all the skills you have in terms of empathy care. The nursing profession has a lot to offer from an educational point of view. You know, there are transferable skills to other careers. So I've seen people come to nursing like myself who can move into, which a lot of people don't understand. They just think nursing is just by its side. There's some people who want to be just clinical. You can go into management or leadership. You can be operational manager. You can be an accountant working in the health service. I've seen nurses who have used their career and gone into the legal field as being a lawyer with a clinical background. You can move into education. You know, we have a lot of professors of nursing, and you need those people. But a lot of them have come in and learned in different areas of nursing and have branched out. Nurses give you the opportunity. I've worked in Africa as well, help the health minister in looking at developing maternity services and looking at the inequalities of health there and why so many women are dying. So your skills are really needed. It's one of those really fantastic career. I think that, you know, I would do it all over again, if you ask me. So I think what we do need is saying to them, there's so many opportunities. All right, I know people complain about the salary. Yes, it's much better than my days. But again, if we do help the students and mentor them well, there's so many posts in the health service, which takes you in different directions, different pay scale, and different opportunities, I would say. But what I want to say as well, I know some people say, why nursing? We're not going home. If you look at the demographic in this country, we're here. If we don't encourage our people to go in every profession, to be there, to sit around the table, to influence policy, because we need that. We need people to speak. What do we need? And if we're going to be part of the society, we need to be part of the society in everything we do. Healthcare. If all our nurses are not there, who's going to understand us? Who understands our culture? Who's going to be there to make sure we're getting the best care? The voice, our voice is important. My thing about doing all of the things I do is wanting to have a voice to make healthcare, quality of care for my people as well as everybody. But I understand some of the issues probably better than other people. But most of us are, you know, you're doing diabetes, you know we suffer from that. You've done a fantastic job with that. So if we're not going to talk about it and sit on the fence, who's going to do it for us? So I think if you look in the hospitals, some areas you've got 40 odd percent, they're black and minor ethnic nurses. So, and if you look at what's happening, we need to be there so we can ensure that we're getting the best from whatever service is being delivered. And you've got to be there to influence, you know?
Let me ask you something about, because you touched on it, you said culture. And for me, that springs the words cultural competence. You want to say anything about cultural competence in terms of the whole nursing and so on? Cultural
competence. I think some people are not very hot on using the word cultural competence, but I know a number of organizations have been talking about cultural competence and people understanding. We all live in this country, come from different parts of the world. Our culture and behavior are sometimes different. And I can tell you, working within the NHS and from a ward system right up to senior man, I've seen where people have been treated so differently. And I've seen people who have been, going to be taken to disciplinary. And when I ask why, some people don't look people in the eye, they look on the floor. Some people, they speak, I can remember one day, someone came to me and said, Mr. Lewis, they're having a fight on the ward. They're fighting on the ward. And I thought, no. So I went down there and there were these supers. They were in the most fantastic discussion, articulating their hand and carrying on. And I thought, wow. They weren't fighting. That's how they were expressing themselves. Probably it might be in the wrong place, but then because we don't understand the culture and the behavior of each other. So I think people need to understand behaviors and culture are very difficult sometimes to change. But if you understand the people you're working with, about where they're coming from, their culture, their behavior, what makes them tick, then you're able to work better with those people. And I think that's part of the thing. So you've got the unconscious bias already,
and
then you have the culture, and therefore all of that's in the melting pot. How do we get those people to understand and to work with it? It's the same. If things continue the way things are happening, one day the minority might flip over. So how do we address that? So it's understanding the groups you live with, you know, being empathetic, understanding, listening. Sometimes we say we listen, but we don't hear. And I think that's part of the problem as well. So we keep saying the things all the time about what is happening about diversity and inclusion. And, you know, as I sit on boards, I keep saying I don't want to sit on a board as a token. I want to sit on a board, yes, it's diverse, which is important. I want to have my say. But the inclusion is also important. If you're not inclusive and sitting on a board, why are you there? Because the inclusion is about your voice being heard, you contributing, you making a difference, you influencing. So for me, those are really very important.
Let me bring it back now to the current pandemic, which we've been in lockdown since March. We've come out
Mhm.
of lockdown, but there've been issues there about the disproportionate number of black people who have succumbed to the virus, i.e., died, those who have ended up in intensive care units, those who have actually caught coronavirus. What take? You have been in the nursing field at various levels, right up to senior level there. What's your take as to why in Britain, as opposed to, say, Jamaica, where it's about 200 people have passed away in Jamaica from it, but here, disproportionately, a large number of black people have died from coronavirus. What's your views on that, Paulette?
Well, there are quite a lot of different views. We have found ourselves unexpectedly in the midst of the worst pandemic we can recall in our life. The experience of such devastation has impacted so many of us and from all walks of life around the world. The pandemic has brought to many of us together in different ways, right? And I have been dumbstruck over the past months of just how many nurses and midwives and healthcare workers and essential workers, not only nurses, who have lost their life, right? We are truly blessed and to remain extremely grateful for the help and support and collaboration and selflessness of these nurses who put themselves on the front line. Now, we do know that many of our frontline nurses are from the Black and minority ethnic group. So the proportion that's going to be affected will be higher in that group. We also do know that the Black and minority ethnic groups, their risk factor, which wasn't taken in consideration at the beginning, about the non-communicable disease, you have the blood pressure, all of those things which they're now saying was a contributory factor, the diabetes. We started the pandemic not knowing as much as we probably could have or should have known about the people and how it would impact. So the first wave really hit us hard because we were on the front line. There are also stories about how many nurses felt that they were discriminated against by being put on the COVID wards instead of their white colleagues. And that as well. So where were the voices to say, let's do this in an equitable manner in the places that was happening? Agency nurses who do a lot of agency, we have a lot of our nurses do agency. They turn up because they're wanting to work, to look after their family, they get put on these wards. So if most of us are facing those clients, of course, most of us will probably end up catching the disease. And, we've lost consultants, we've lost so many, nurses, porters, and, from all across the Filipinos are the highest group, of course, the Caribbean as well. But in Jamaica, I can tell you when I was part of a symposium, the West Indian Islands, the preparation, I was so proud. And that's part of it. If you ever have time to speak to them, how they prepared for the first wave in the islands, and was speaking to some of their senior nurses, I was gobsmacked. They were well prepared, they had everything in place. They were absolutely prepared. So again, it's about the preparation. It's about understanding how you protect yourself, because again, we had problems with PPE here, and a lot of people felt that wasn't managed very well. So the first wave has happened. We're now possibly moving into a second wave. What we've got to ensure, what have we learned from the first wave of this pandemic? How are we going to take the experiences from the first to make sure that we do not experience the loss and devastation which we have in the first? And I think that is what a number of organizations are looking at, learning and resetting and say, how can we do things differently? What have we learned? Because we're not quite sure just what will happen, but in preparation, in making sure we have the right equipment, the right PPE, supporting our staff, being equitable in our distribution of staff, and looking at the risk assessment of the groups of staff, and making sure they're allocated in the right place is really very important. And not only that, but there's the mental health issues that are coming out of this, other than the inequalities of health. Those people who have lost their friends, their mother, their father, and they're still working, they're not able. We've got a mental health issue that is there, that if we don't manage that, that in itself is going to be as big as the pandemic. So there are lots of different challenges that are going to happen. I know in the West Indies things are moving in a different direction, but if they still apply the principles they had at the beginning, I'm sure they will be able to manage. But I think if you speak to them out there, it was a preparation, it was a lockdown, it was a strictness, it was about people being, adhering to the rule. So what I would say is that we need to start adhering to the rules now and make sure that we're safe. And we have a responsibility, not just what the government say, we also as individuals and family have a responsibility to take care of ourselves and our families and our friends and our neighbors and be safe.
Thank you. I would say a shout out and a big up to the Caribbean islands because they really did prepare
really
well.
well.
Yes, in comparison
really
to
well.
what we call countries like Britain, which is supposed to be a developed country. It lacked a lot of preparation.
Yes,
let me move on to back in 2014, so that's over 6 years ago. You were given the honor of a Queen's Award, an MBE, for all the work that you've done within nursing and within the charities that you've been involved in and so on. Tell the viewers and listeners, how did that all come about? It seems like a lifetime away.
It seemed a lifetime away, but yes, that it was it was really great, an honor to have someone out there thought I was doing something good.
Good.
To have nominated me for an award from the Queen, which I received in 2014 for contribution to nursing and to charity work, because as you know, I'm a great fan of charity work and do a lot of charity work. As I said, I went to Africa in different places. And prior to that, a few years before that, I was given a European Humanitarian Women's Award, again for work I do in the community and supporting charities. And so that was really good. And then because I do a lot of work in relation to charity as well for Jamaica, in 2018, the Prime Minister gave me a Medal of Appreciation for the work I've been supporting and, doing, carrying out.
Well done.
I felt really proud and honored to have received the MB, but that again was not just about me, but also working with the Nurses Association of Jamaica charity, has done some fantastic work in both in this country, money in projects in Jamaica, in other Caribbean islands. We have supported hospitals and schools in Jamaica. We've worked closely with the Jamaica High Commission in a number of projects. And, so being part of a very active community organization and giving, to people who are less fortunate it's very fulfilling. And, I must say, Nurses Association has been around now for over 40 years, 42 years. And, I've been a co-author of the book, our first book out, Our Legacy, so people can read. 40 Years of Service is the name of the book. And it's on Amazon. And I think because that gives you a history of people coming here way back when. And that's what I'm talking about, caring and looking after each other. When these nurses realize they're coming here like long time ago, who's going to look after them? They need to know the ins and outs. So, these nurses, Dorothy Turner, who was one of the founder members, brought people together and said, pull this organization together. And that's what we're good at, is being there to support each other, to make sure they knew the rope and help them. And that's developed 42 years of lots of hard work. So yes, that's another very good accomplishment, not just for myself, but I think organization and all its members have done fantastically well. And my nursing career as well, I would say there has been a number of people who have supported and helped me along my way in my career. And my family has also been really supportive. And, my sister Eva, who we lost,
Yes, who was a doctor.
as she's been a doctor, and we always talked about she's a doctor, I'm a nurse, we could do things together, but we don't know what tomorrow holds. And I think the important thing is that we must live each day as if they said the last day, but live well and do good and feel contented in oneself.
That leads me to, because you went on to mention a lot about the Jamaican connections. Because one of my questions was going to be, have you maintained links with Jamaica? I.e., how often do you go back to Jamaica to see what's happening out there or so on?
Well, I know I'm normally over the years since I've been here, I'm home nearly every 2 years. 3 years is a long time for me. So I was always frequently at home. And I made quite a lot of links in Jamaica. So when I go to Jamaica now, I know I have people at UTech midwifery that we've been supporting by the equipment. I have people at the Ministry of Health that we're doing. I have so many different links in Jamaica in the nursing profession, education. And I have my family there as well, who I love and want to see. And Portland is really beautiful and nice. It's good to go and sit on the veranda and get the cool breeze and the coconut water. So my links to Jamaica is one, I'm always there, and I'll continue. I'll always go in there and keep those links in Jamaica.
With such a busy life, professional wise, career wise, etc., how do you chill out, relax? What do you do to, just?
How do I chill?
Yes.
One of the things I like music, and I like dancing. So I must admit, when I'm home, I'm always playing CDs. And then downstairs, sometimes I'm in that back room doing my little thing, And I think part of the relaxation and the chill out for me too is actually working with my charities. Because we have a concert every year, and I write plays and do drama. And we also do folk singing. And that, the group, just getting together with those ladies in the evening and having, all those old time songs and all the different Jamaican mental music that we dance to. That's just fantastic, So although we're working, we're actually also enjoying being together. Because remember, these groups are not just about raising, it's a social, socializing and being with people, which is what we're missing now with COVID. So I like doing that. I like my garden in the summer. I just love a lot of flowers. So I'm always pottering about my garden and doing flowers. And I love traveling. So this year I thought, after the rough year I had last year, that I was going to do a lot of traveling and, explore a bit more. But because of what's actually happening, that's not able. So I spend my time more now. I do a lot of talks over the Black History Month. I've done about 5 seminars with different groups of people talking about Black History Month. I mentor, coach, and that gives me fulfillment, because I think I like to help people and I like to give back something, and hopefully those people who help me, I help them. Don't draw the ladder up. Keep it down. Put one hand out.
I like that.
To pull people up as you go along. So that I do as well, and when people bring back and have those little chats and I see that they've progressed, fulfilling.
Let me ask you then, what tips or advice? You've come from a nursing background. We're in sort of still semi-lockdown, and some people are in lockdown, and people are at home. Single people or elderly people are on their own at home. There's issues about mental health and coping with the stress of all of this. What tips and advice would you give to somebody listening to this program who is unable to be out there and about and so on, but wanting to try their best to take care of their mental health and their physical health? As a nurse, come on, spill the beans here.
Diet. I think people still need to think about the diet and the sort of food you eat. Yes, there's no point sitting home and just having a lot of carbohydrate and sitting down. So you need a healthy diet, and you talk about lots good food, lots of protein, good. Look at your vitamin D, your zinc, what you need about for your immune system as well. You need physical exercise. So even at your home, some people went up and down the stairs a couple of times. If you have a garden, you walk around the garden if you can't go out the road. In your bedroom, I try to get up and I've got a 7 minutes exercise my friend sent me, which I found very useful. You get up in the mornings and you do something. You don't just sit down in one room, you try and move around. It is now getting cold and some people can't afford heating. But whatever you do, try and make sure that you have even one room warm, that you don't sit in the cold and get hypothermia. And I think isolation is really very difficult. And therefore, how can the charities, if you know someone, you ring, have a little talk with them regularly, put your TV on and your radio, listen to what's going on. But I think the personal contact is what some people are having real difficulty with, not seeing their families and their friends. So you can use Zoom. And that's where beforehand I worked with a charity that was going around to the elderly and setting up and showing them how they can set up Zoom and social media so they can have conversation with their family and friends. And, open the door. You might not want to walk far outside, but do go outside and get some fresh air and try. But the mental and physical is, you might want to stay in bed. Don't. Get someone to ring you and say, what are you doing now? Come on. And if you've got Zoom, you might do exercise together as well, But I think the mental bit is the more, but it's your diet, your sleep, your relaxation. And the other thing too is with COVID, there's an economical pressure now on people. And if you watch, some people having problems because they're not working. And that is another big problem that's coming on the economical situation. So how do they keep the heating on all day when they're not working? How do they buy the right food? So, someone helping out as much as you can for those people who are in need, where the charity work comes in a lot, especially in, our BME forum and thing, has been a savior to a number of people and some people can't pay their rent. And some people now, where do they go? Because people are saying you can't pay your rent, you can't stay. Some people, so you got the isolation, the mental, the financial, the physical, the food, the diet, and what about your children around you? If either they can't go out, they're in the house, you don't know how to manage them because they want them out to school when that was happening. And those people who can't even see their elderlies, they can't travel, the tier 1, the tier 2. So all of those combination of things, but it's how do we make contact, some socialization, either through the phone or someone coming and standing outside and talking to you to see you, or something like that, to get some normality the best you can. It's difficult, it's unprecedented, and people, we, the elderly one, have to help those who are in need. As how can we help to make their life a bit more bearable in this time when it's so difficult, so difficult.
Okay, Paulette, you've given us a lot of food for thought, lots to think about, lots of tips and advice along the way. I'm still going to ask you to end off this lovely interview with what final thought would you want to leave with the listeners of Breakthrough TV, Our Health is Our Wealth show? Any final thought you'd want to pass on to them?
I think I love the saying, our health is our wealth. No matter how much money you have, right? If you're not healthy, you won't enjoy it. Absolutely. I would say to everyone, I was talking to a banker a few months ago who said to me, do you know how much money is in the bank for West Indian people that's not being claimed? We need to share. We don't tell our relatives about our health. We don't share things like that. So sometimes we're not even sure what's going on. We need to feel more confident in getting help to sort our business out. And then, people are living in cold houses who's got loads of money in the bank and they're waiting for when you reach 60, 70 or whatever. Come on, you've worked hard, your health. Eat good, drink good, sleep good, keep warm, enjoy life. Because I tell you, we ain't taking anything with us. And if you have too much to share, put out a helping hand. Let's help each other. And that would be where I'm coming from. Helping each other, supporting each other, and hoping that we really do try and enjoy as much as we've worked for. And those people who are needy, if you can help, help.
Right. Paulette, I have to give you credit and thanks. You clearly come from a nursing background. It's about caring, it's about sharing, it's about showing empathy towards people in other situations and so on. It's clearly coming through. You chose the right. You are the modern day equivalent of our Jamaican Mary Seacole. Mary Seacole. People who don't know about Mary Seacole need to go and look up about the black nurse who came to Britain during the Crimean War and helped look after wounded soldiers. Paulette, thanks for coming on Our Health is Our Wealth show. I thoroughly enjoyed hearing you talk. The passion just comes through. It's so natural. Thanks very much for coming all the way from Croydon in London via the television to talk to us on this show.
Thank you, Tony. It's a pleasure. And as always, keeping in touch and being friends. Thank you. And all the best. And you're doing so well too.
Thank you. Walk good.
Walk good. What you're doing. And
stay safe.
And we'll stay in touch.
Yes,
Thank you very much.
We will. Thank you.
Okay. Good night. Bye-bye.
Bye now.